Okay, so we are going to be pouring up models in stone. Before you do anything, you want to make sure that you trim your alginate impression. You want to get any excess material off that you don't need, because it can actually cause rim lock and it will stick together. So you kind of almost use this as like a paring knife. You can kind of go through like this. You can set it down and cut however you would like to do it. Ooh. You just don't want to tear any anatomy. And this is why we tell you not to pull this while you're in the clinic, because you can actually pull off anatomy that you don't want to remove. And then we're just going to set this on the side here and throw it away after. And I'm going to trim both my Max and Man just so they're both ready to go, even though we're going to pour them separately. And I usually do cut the sides off. Again, I just don't like anything stuck. This side. Okay, good. And then I'll have you just zoom in on that. Okay, and now for our setup. You need to have all of your armamentarium out and ready to go. So we have our spatula for pouring. Remember, this is different than the alginate because it's a lot more rigid. It's not as flexible, okay? So you need this spatula. I also like a small spatula for pouring the anatomy portion. We are doing stone today. Stone is yellow. So we have measured out 100 grams. When you put the bowl on, you tear it, and then you put 100 grams of just the stone in here. You have a Max bowl and a Man bowl because we are doing a base for both of them. You also will measure out 2 cylinders of water, 30 milliliters and 30 milliliters in each. All right, so I am gonna start with my maxillary first. I also have little papers that we can put our patty on. It's just so it doesn't stick to the tray paper. That's a little bit more shiny and slippery. All right, so we are gonna pour our water in. And make sure you have your vibrator plugged in and covered with a tray paper. So you first just want to incorporate the material just like alginate, but you are not going to mix it nearly as long as we do for alginate, because you just need to incorporate the powder, and then you're going to use the vibrator to actually get all of the bubbles out. So just mix it all together like that. Good. And that is all you really need to do. I try to keep my spatula nice and clean. I'm gonna turn this up. I'm gonna put on here with 2 hands, put a little pressure, because you wanna make sure you're putting pressure down so all the bubbles will rise to the top. You will see bubbles coming out. When you see the last bubble come up, that's when you can start putting the material into your impression. So that's looking pretty good. I'm gonna give it a couple more seconds here. Okay, good. Then we're gonna set this down here. You're gonna pick up your impression. This should stay on the dental vibrator the entire time, because you do not wanna get air bubbles when you do it. So you're gonna put a little bit of stone on here, and in the back corner, you're gonna set it here, and then I want you to use the vibrator to move the material, okay? Have the vibrator do the motion for you. Some people like to just add it from one corner. As a personal preference, I like to add it from both sides and kind of connect in the middle. I've never found that one way is better than the other, so you can just do it whichever way you prefer. When you go out into offices, I imagine the assistant will have a favorite way of doing it, and that is totally fine. Good. And just keep moving that down. This is the most important part. This is where you want your fine detail, all right? You want to pick up all of the anatomy that you just took the impression with. So this is where you want to take your time. The rest of it, you can move a lot faster, but make sure you don't rush this part too much, because you really want to get all those fine details. And then we're looking just to cover all of the teeth. So until you don't see any more tooth indentations, that's when we're actually going to switch our other spatula. But see how I'm angling it down towards me? If you hold it back this way, all of the material will pour out, and you will actually run out of stone at the end when you're trying to make a base. Okay, so that is good. I'm gonna set this, see how I like wipe the spatula? Try to keep them as clean as possible. I then take it off the vibration for a second, and then you're gonna frost it like a cake. For the max layer, there's a palette, so you are gonna cover the palette. Then I quickly set it down to incorporate it. Then again, you're just gonna frost this. And every once in a while, I'm just gonna set it down to incorporate. Good, and you want it just nice and smooth. Gonna put a little on the back here to cover that. And I'm gonna clean this up as I go, just because you don't want any stone on the outside of your tray. As we talked about in lecture, that will cause rim lock. So now we have that nice and smooth. We're gonna set that down. You can turn the dental vibrator off, and then you're gonna take all of the material that's left, and you are going to make a patty or a brownie. There's many different names for it, or a base. And if you don't have a lot of working time, you have to get this out. Some people will use their hand if they get desperate, if they need to be fast. I don't have a ton of material left, but it's just enough. So now this is supposed to be the trapezoid. As I've mentioned, I'm not great at making trapezoids, so as long as the material is wider than the impression tray that you're putting on it, that is fine. I just want it smooth and wide, but usually I try to just go, you just take it flat like this and move it and shape it that way, and then just smooth it out. Okay, now we're gonna flip this down on over. You're gonna flip it down on over like this, and you're gonna give a little wiggle to incorporate it. You're then gonna stabilize it here, and you're gonna push it up like this. You only attach the back. Again, remember, if you attach other areas, it's gonna cause rim lock, and you're not gonna be able to separate your impression. I actually don't like this little area on top, so I'm gonna quickly cut that off. Okay, good. And then if you have material on the tray, this is where you would come down and just kind of like fine tune it and just push it off with your small spatula, okay? And then we're just gonna leave it to set. You're gonna leave it when it's liquidy like that, you're just gonna leave it, you're gonna write your name and put the time that you did it, because it takes 45 minutes to an hour to set. So it's good to write the time down so you can track it. All right, and then last thing, when you clean up, it is not like alginate. You do not wanna leave it on there. It is not easier to clean up after it is set. You wanna clean it as soon as possible. So grab a paper towel and wipe it all down, go over to a sink and start wiping all of your spatulas down, and then wipe out your bowl. I usually go wet the paper towel, and then I just give a quick swipe in the bowl and wipe it all out and throw it in the trash, okay? All right, and then we'll do mandibular in a second.